Now, of course, we've talked about the outgoing patient treatments and those patients who unfortunately had to suffer through some of the more gruesome aspects of surgery, and those were the ones that had to stay behind when, of course, they were sent from the operating room to the recovery ward. And we see that, especially in the Spanish hospitals, a lot of these people, they would get their own bedding, their own linens, and they also would keep up with very hygienic practices. Now, in American hospitals, the bedding was not exactly the greatest. In fact, it had a lot of bed bugs, and it was because of the bugs that were hiding out in the pine straw, the corn husks, or whatever they used to stuff it with. And this is where we get the expression, don't let the bed bugs bite from. But of course, as we talked about in the last clip, the Spaniards, although they were using Spanish moss, which has chiggers, they would boil it to kill off the chiggers and then let it dry before they stuffed it into the bedding, so you didn't have to worry about the bed bugs. But also, aside from that, this bedding was one and done per patient. So once one patient was removed from the bed, the Spanish moss was taken out and burnt, and then the bedding itself was boiled and cleaned before being hung out to dry, and then they would restuff it with fresh Spanish moss. Now, in keeping with the hygienic practices of the Spanish hospitals particularly, we see that not only bedding and linens or blankets, as well as clothes, but also utensils and cutlery were actually designated with numbers, and a patient would be given a designated number. And so, for example, let's say that I'm a patient, I'm at the hospital, I am patient number 1, and this is my cup. It's going to have a number 1 on it, either marked into the clay, or it's going to be printed on there in some way, shape, or form. Whenever this stuff was taken out to be cleaned by the attendees, they would know to bring it back to the exact same patient. So this helped to prevent cross-contamination, interestingly enough. But while you were there recovering, and quite honestly, in a pretty good state, all things considered, at least in the Spanish hospitals, then the physicians and attendees would make sure that they tried their best to get you back on track, and they did so with a combination of diet and medicines from the apothecary. Now, when it came to the average diet of a patient, it typically consisted of chicken, beef, pork lard, bacon, bread, the seasonal fresh fruits and vegetables. And quite honestly, I don't know about you, but that sounds pretty good. And if I'm getting that as a daily ration, I'm definitely going to recover a lot better than if I were to just be languishing in bed and eating nothing but porridges or soups and stews all day long, and the quality of which might be in question in the American hospitals. But what about the medicinal aspects of things? We see that with the apothecaries, a lot of them, they provided the medicine for these hospitals, but in some cases, there were some hospitals that actually had their own gardens outside where, depending upon the season and what could be grown in the territory in which they lived, they provided 99% of the herbs that were, and roots and so on and so forth, that were used for making teas, tinctures, jellies, salves, ointments, you name it. In fact, at the Royal Spanish Hospital in Spanish Florida, the Hospital of Our Lady Guadalupe, Ramon de Fuentes had his own garden in which he could grow all this stuff. And so he made all of his medicines there on site. And he would use such things as lavender to help keep the patients nice and calm. Lavender, of course, was also used as a cleaning agent of sort. Wounded warrior's wort, as it's sometimes called, could be used to help coagulate the blood flow to prevent patients from bleeding out. Now, there's a few other medicines and treatments that would have been used on hand and would have been grown in the apothecary's garden, but we'll have to discuss that in our last and final clip.